The following is a JourneyWISE Network production.
I'm Shane.
I'm Ronnie.
Ronnie and I have been friends for 40 years on this journey, and so we want you to be a part of it. So grab your mason jar and come join us as we grow JourneyWISE together. Hey Ronnie.
Hey Shane.
How are you?
I'm fine, and you?
I am so excited that we get to invite all of the JourneyWISE folks on our journey.
Well, it's an interesting journey. I think they will find that if they will hang with us, they will see. They will probably learn a lot of things that most people don't know.
And a lot of people don't want to know.
Don't want to know.
Yes. So question number one for us is, when were we in the same room together first, and how did it affect our lives?
Okay, so 1981.
Yes.
We were in Hattiesburg, Mississippi, in the emergency room at Forest General Hospital.
And you weren't a real doctor yet, but you were a third-year resident.
Well, which is a real doctor.
Okay.
I could
put
MD behind my name, but I was not a fully trained doctor in pediatrics.
I was just kidding.
Anyway. I know,
yeah.
But, I was taking call for practice there in Hattiesburg, and they called me to see a 12-year-old boy that had bumped his head, which usually meant there was an overreactive mother, because I asked, how was he doing? They said he was stable, no real symptoms. So I walked in the room to meet you and your mother.
Mm. And I turned out to not just be a normal young boy with a bump on his head, and certainly didn't have an overreactive mother.
No.
But had a very focused mother.
Yes.
I had hemophilia.
Yes.
And what happened when you discovered that I had actually hemophilia?
Well,
a bump on my head.
The thing about pediatrics is you make a diagnosis really in the first 30 seconds of being in the room. And people probably don't understand it because our presence in the room affects the patient. Most children don't like pediatricians, and so
or dentists.
Yeah, I'm not even sure most mothers like pediatricians. So I walked in and you were sitting on the table smiling, and here again thought that it would just be a routine little thing, send you home. And so I asked your mother, had you been knocked out? Had you had any vomiting? Did you have problems walking, dizziness? Any pain, significant pain? No. But then the big question, does he have any medical problems? And she said he has hemophilia. And so, which some people may not know, that hemophilia makes it a lot easier for you to bleed from a minor problem, where the vast majority of people would not have an issue. A hemophiliac could die from a head injury.
Yes.
And so we had to go into a whole different avenue of treatment.
Did you ever ask me how I got the bump on my head? I don't remember. No.
I think at a water park you were in the bottom of the pool, in the pool, and somebody slid down and hit you in the head.
What actually happened is that my friend and I went down together, and we had a contest going on and who could stay underwater the longest.
Oh.
And so while I was underwater, a big old fat guy hit me with his knee right into the middle of my forehead, about knocked me out underwater. And tried to go do everything else, and this thing kept growing on my forehead, and I thought, maybe I should tell an adult about this. I told my best friend's mother, who always, how do I put this? She could overreact a little bit.
Sure.
And she screamed when she saw the bump on my head, which made me feel like maybe I should have told her earlier.
Well, hemophiliacs, people used to come in all the time and bring their child and say they're bruising easily. And so you would look at their shins or their forearms, and it would be typical, 6, 7, 8-year-old, whatever age, boys in particular, just a little grayish blue bruise. But a hemophiliac bruise is a whole different thing. It's a dark purple, significant bruise.
And I don't think I've ever told anyone why I was under the water so long until this very podcast.
Really?
I don't know if my mother knows that, and now she's going to listen to this.
Probably
in her very fragile old age, she's going to hear this, and she's going to come whoop me for that. She did used to wait until I had to get factor in order to, then she would whip me for all the things I had done.
It was that smile on her face
Yeah.
when I would say, we have to give you factor.
She used to say I'd make him walk to the end of the house and pick out his own switch, and I'd say, no, you made me limp to the end of the house because I was hurt in order to get factor to get my own switch, and so there was a difference. But I think what's so interesting about our story, I make fun of it. It began a journey for us because you ended up moving to Hattiesburg and you began working at the same clinic where my pediatrician, Dr. Temple, who was a wonderful man, and I think I'm the one who drove him into retirement. And then you just sort of following me, and my mom absolutely felt so good, Ronnie, about you because you whether you knew what you were doing or not, you really gave a sense of comfort, and you did know what you were doing, but you've said later that, you didn't get trained in a lot of hemophilia stuff.
Well, and I had great backup.
Sure.
Dr. Iyer, Dr. Pullen, were the hematologists at the medical center. And so it was a very cooperative treatment. And the problem with any chronic illness is that as a pediatrician, we're usually able to treat something and it's over.
Sure.
And you weren't the only hemophiliac I treated, but there were probably not over half a dozen.
What? There were others?
Yes, there were others.
I'm just now hearing about this.
Well, I tried to keep it from you.
Yeah, I know. I can understand.
But not being able to take care of a need and finish it,
sure,
was always frustrating. So when you would come, I would always know that it was usually going to be something significant.
Well, I was a mild to moderate, and I had kind of a rambunctious side, and I loved to do things that all other little boys love to do, and I would do things that I knew had a high risk of hurting me, not because I wanted to be hurt, but because I wanted to enjoy what was happening, and I'd had a lot of injuries. I really saw, I was kind of always in this tension between wanting to be normal and understanding that normal could be dangerous. And I think one of the things I really respected of you is that you seemed to understand that. Dr. Temple did not understand that. He was very clear that I was fragile and crazy. But you didn't do that to me. And I think maybe it's because you were young and having your own children and you understood. And I think you were a pretty normal boy, when you were growing up. And
I did not need factor. My mother whipped me every day. So it was not, and she would pick the switch herself.
Oh, that's even better.
And yes.
But I think the thing that I loved was the fact that I felt like that you genuinely understood that you had to make choices, and you've said to me before, I remember, well, you kind of made the choice. I hope you enjoyed it.
This time you chose poorly, but
you chose poorly. Well, our journey moves on. We go for about 5 years. I have eye surgery, and while I am, and you and I dealt with the whole AIDS crisis for the first time together because the warnings came out, and you had to find other ways to raise my clotting factors, and you found that in a female hormone, if I'm not mistaken.
Well, we used fresh frozen plasma and other things that could help in that, but none did as good as factor.
But I experienced my first hot flash at 13, and but then by the time I had eye surgery, I didn't know that in October of 1986 that they had tested me, and I don't know if y'all drew straws or what happened, but you had the job of telling me that I was HIV positive in 1987, and that was really not a great time to be told you were HIV positive.
No.
It was a pretty scary time.
No, and you were the only one. I dealt with that, and so the information was still. To be quite honest with you, to give somebody that information was fairly fatal. And so to be able, because we developed a pretty close relationship by then.
Absolutely.
With your family, with your stepfather, who never acted like a stepfather.
No, never.
Never.
So
he was great. And so to have to sit down, and the reason we talked, Dr. Iyer and Pullen and I talked together, and the reason, and they asked, he can come back up here if you want him to. And I just felt like, because it wasn't something, a phone call needed to,
Sure.
And so we felt like it needed to be in person. And I said, sure, I'll do it.
And I remember I was on the way to play golf. I was on the way to practice at the course. I was playing on the high school golf team, and I remember Mom had said that your office had called and asked if I could come by, and I had no idea, not a clue as to what was going on. I was dating this young girl with a very funny name, Pokey, and life was good. I went to bed one night as captain of the golf team and president of my class and dating the prettiest girl in school. And the next day you give me this news. And one of the things I don't think I've ever heard you really talk about much was people hear what it's like for me to get the news. What was it like to give the news?
Well, here again, pediatrics does have that sort of thing. I mean, I think the most frequent, what might be considered bad news, would be that your child has Down syndrome.
Sure.
Because that was something that we could pretty much pick up just from the symptoms, but you never wanted to say that until the blood work actually came back.
Sure.
And so it was that period of time that physicians really don't like to put people that waiting. We've done a test. Sometimes you can do it without having to tell them, but most of the time you do have to let them know that there are symptoms, but we just don't know for sure, so we need to run tests. And so you try to prepare yourself for what's next. What's the next thing? And I used to have somebody that I would Henry's mom. I would always say, this test is positive, but I have somebody for you to talk to. Because once they met that mom and Henry, it took the whole. I think the almost death sentence, the death of a vision of a normal child,
Sure.
And it moved it to a place of, this is okay. I can deal with this. Sure, I'm not glad it's happened, but I can deal with this. I can make this child have a life that's worth living. And yet, when you come up with a diagnosis, this has been one of the greatest things to watch. When I started in pediatrics, when you diagnosed a child with leukemia, it was about a 95% 5-year death.
I can't imagine.
Now that's almost reversed.
Yeah.
So that it's not nearly. Well, at that time, telling somebody they were HIV positive was pretty much 100%. And so you had to prepare yourself for those questions. Was I going to tell the complete truth? Or was I going to still hold out hope that maybe this time?
So, and there were two things that I have not thought about until we've gotten older in our friendship, and that I didn't even know that you were struggling with the whole idea that you may have prescribed the factor that I became positive.
Not may have.
Well,
I pretty much probably
much
did.
And I have never thought of that. Never once did I ever care about that. That's just never been an issue for me. But as a physician and as a person, I've tried to think about it from your perspective. The other was there was such a stigma attached to HIV and AIDS at the time. It was a really difficult thing. I mean, Ryan White had just happened the year before. The Ray boys, their houses were burned that year. And there really was concern. I mean, I remember the one thing I remember most is you looked at me and said, you need to be careful talking with your mom about who you can tell. And I'm sure that was not something that you talked about a lot in pediatrics. You really, for your own safety, you don't need to tell.
No, never.
Yeah.
I mean, an asthmatic, be sure and tell the mom when you go to spend the night with somebody else that you have asthma, so that don't let the cat in the room, that sort of stuff. A diabetic, for sure, if they went to somebody's house. But there was this terrible stigma that went, because there really was only one way that the general public felt that you would become HIV positive.
Yeah. And I do remember when after I got home that night, I went on and played golf, by the way.
Sure.
That year I went on and played golf. And when I got home that night, Mom was very emotional and very thankful that she had not had to tell me, which I always will be so grateful for you to do that instead of her having to do it. But she then said, now listen to we need to talk about who you can tell. And the only person that she said she said, you can't tell your pastor. We can't tell our pastor. Nobody at church. I mean, went on this long list. The only person she said that I could tell, do you know who it was?
No.
It was Pokey.
Well,
Because I was dating
that
her.
wise? Yes.
I was dating her. And so I felt like I really have a lot of respect for my mom in that, because I'd only been dating Pokey for a couple of months. And I am so thankful. I want to say this, that Pokey and I had been through a youth program together called True Love Waits.
Yes.
And if we had not waited or had participated in other things that you shouldn't do until you're much more mature in a committed marital relationship, I could have honestly hurt her.
Yes.
And to this day, 32 years of marriage, I married that pretty girl, by the way. We have three daughters who are wonderful, and everybody is negative. But I remember that was when it hit me. Oh, wait a minute. This is not something else that my mom and I have to deal with. My father would not tell my grandfather because they felt like he couldn't take it. None of my grandmothers knew. My grandfather found out from my maternal grandmother. My mother told her mother, who told my dad's father. Now think about that graph you have to work out. And that's when my grandfather got me on the golf course and said, so what you going to do with this thing? He wouldn't even say the title of it.
Yeah.
And I'd say, I don't know, there's much I can do. He said, you can get in the corner and cry about it, or you can make every day count. And I already knew the answer he had. And so I'm excited about this conversation and journey as we go along. I think there's a lot that you and I have unpacked over the years, and a lot that we've been through over the years that I really do think people need to hear, and I think a lot of folks will want to hear it, and I look forward to it. I think it's going to be special.
Well, to watch it evolve, to watch not just the medical side of it, which obviously you're still here,
absolutely, and
doing extremely well, and I'm no longer your pediatrician.
No, you're no longer my pediatrician.
So let's make that perfectly clear. But not only the medical aspect of it that I've gotten to witness, what I consider fairly miraculous,
sure.
But also I think to help people maybe appreciate, don't ever take a relationship for granted.
Sure.
Don't ever say they're only a neighbor or they're only an employee, or always allow God to develop a relationship and take a relationship where He wants to take it. Not necessarily what you see in it for yourself, but what He's got in it for really your world.
Well, other than my wife and my mother, you are at all of the important interchanges of my life. And I think those who are listening are going to hear that as we go through this more. So thanks, Ronnie.
Hey, thanks.
Hey guys, it's Shane. We're so excited that you're on this journey, and we want to thank you for joining us. If you like what you hear, it would mean a lot to us if you'd subscribe to the podcast and give us a 5-star rating and review. And of course, stay tuned to all that God's doing and working to make all of us JourneyWISE. Well, hey friends, welcome back to JourneyWISE. I'm Shane Stanford.
And I'm Ronnie Kent.
And we are so glad that you've joined us as we continue this conversation about a very special journey that we've been on, and how we've learned so much about life and about struggle and about opportunity, but most importantly about the hope and grace of God.
Amen.
One of the things that I think is important for us to mention, and by the way, we've learned a lot about podcasts over the last few weeks of our lives, particularly
how not to do podcasts. Yes.
But we missed something last time, and we just want to be honest and go back and correct that, and that is
that the way you contracted HIV, or became HIV positive, was through the factor VIII that you were given by me to help you not bleed because of your hemophilia.
And I've had people ask me before, are there things that were unique to being HIV positive and a hemophiliac? And really and truly, there were a couple of things that were different. We don't, for instance, seem to get much KS, Kaposi sarcoma.
Yeah.
But some of the medicines would cause bleeding and other things you had to be very careful of. But it was mainly just the significance of the diagnosis.
Right.
And, I stayed pretty healthy for a little while.
Oh yeah,
after that.
and I think that's what people have to understand. It can be kind of almost a silent thing,
Sure.
and that's why a lot of people, when they did become ill with it, it was really a very fast process.
Fasting.
Yeah.
Well, I remember one of the things that I remember saying, I think I made a joke at one point. I'd come in to see you for something else and said something about, gosh, if I get sick, I get to go to Disney World or something. I mean, I remember it just being so flippant, and you said it was the first time that anyone had really ever made me think that, most people who die of AIDS, they lose their vision, they can't hear, they're in absolute pain, they waste away. And it was that stark. I think that was the thing that I always appreciated about you, is you never sugarcoated it for me. You wanted me to deal with it realistically, but you also knew I was a person of faith, a person of great faith, and my mother was a person of great faith. And so it was, while you were telling me the tough things, you knew that I had a hope that transcended me.
And would it have been a shame if I had not given that? Because look where you are today.
Oh yeah, I mean,
to take that away, I've had experiences in the past where there was one that just stood out to me that just angered me so much, and that was a child that had a small head. And as they were coming in for checkups, you follow that closely, and the head didn't seem to be growing. So I sent them to a specialist, and the mother came back all upset, and I said, "What's wrong?" And he said, "Well, when he measured the head and looked at the growth chart you sent to him, he said, 'I'm sorry, your child will be mentally handicapped.'" And I said, "Oh, for what reason?" He said, "All children with a small head are that way." And I knew for a fact that was not the case. And subsequently, that child did well in school and developed normally. But what a tragedy to put that thought in that mother's head.
Absolutely no hope.
No hope.
Yeah.
And I think that's the great thing about God, about Christianity, is that you always have hope. There's nothing that you encounter that takes away hope. Now, in the physical realm, we call those miracles.
Absolutely.
When God steps out of the normal progression of a disease and does something extraordinary, supernatural, we call that a miracle. But there's so much of life, in particular for a Christian's life, that it's not a miracle. It's just the process of God using a very difficult situation to cause us to become more like Jesus.
And I don't think you maybe knew at the time, but your faith and how faithful you were, as you were not just you weren't the Christian doctor, but you were a doctor who certainly was Christian, and you did not hide that. We couldn't tell my pastor. We couldn't tell so many people in our lives, other family members. So you kind of acted as that anchor of hope and grace for us. And my mom talks about that and how important that was and the important role that you played. I went through the end of my high school days continuing to do some stupid things that I shouldn't have done and getting hurt.
But you were fairly low on the stupid scale as far as most teenagers. I'll be honest with you. You were better than most, and so let's not take the fact away that you were a very responsible young man and
I tried.
Did well.
I think I tried to be better as I got older because I hated to see the way it made my mom feel and how it hurt her. It just worried her, and so I did try better. I did end up, as I think we mentioned last time, going into a deeper relationship with this girl that I was dating, and we decided that we were going to get married. And what was interesting, by that time, I was turning 18, 19 is when we got married, and I was not coming through the front of the pediatric clinic. I was coming in the back door of the pediatric clinic. And you would have me go sit in your office until the nurse came back and got me all the official stuff. But, we spent a lot of time preparing me for whatever life was. And, I think, Ronnie, I've tried to give myself some perspective from your point of view that, while we're dealing with this, and you were the first one to do a T-cell count, which measures the health of your immune system, and you're the first one to see it start going down, which meant that I was going to have more advanced treatment. But you never flipped the alarm switch. It was always, well, this has happened. Now we're going to have to deal with it, but the one who can help you deal with it. And that was always the point. I think one of the questions I've always had for you, though, is, has there ever been a time that you faced a situation as a physician where it got on top of you that particular day?
Oh yeah, I remember one in particular. A child, I was on call, and they called me to the They called me. We had what we call after-hours clinic in the afternoon, 2 to 5 at our clinic, and they called me about 4:30 and said, "We've got a child in the emergency room, one of y'all's patients, that's pretty sick." And I said, "Well, I'm 30 minutes away from getting there. He's sick enough I need to drop that," which meant another person would have to come in and people would have to wait. And so, and they said, "No, you can go ahead and finish seeing that patient." And so I finished seeing him, walked in the emergency room, and walked in the room and knew immediately the child was very sick, very ill. And so within just 30 minutes, we had, drawn blood work, done a spinal tap, actually gotten some medicine in for the child to treat that child. And subsequent, the child subsequently died the next day, the next morning, from meningitis, a very fast acting, and he was actually in church that morning. So you can imagine the concern of all the people that were in church with him that morning, and how contagious was it, and all that sort of stuff. So I was up all night with that child in the intensive care unit, and then the next morning he died, and so I saw patients all that day, and that afternoon the local television station called and said they needed to talk. Could they talk to me to try to help people?
People were
so
the news
concerned.
was getting out.
Yeah, the news was out, and so they came to my office, and so after they left, and after I'd finished work, it was about 6 o'clock. That I was sitting in my office, and it was just one of those things. It was actually kind of anger toward God. Why? The first question was anger toward myself. What could I have done better? What could I have done different? And then there was this anger toward God, because I absolutely and still do have such a faith that God can heal anything. If He's willing, if He chooses.
But in a broken world, not everything gets healed the way we want it.
It doesn't work the way we want a lot of times. So I felt like is this worth it? God has never spoken to me audibly. I've asked Him to. He's not chosen to do that. But there's been a few times when it was such a strong impression that I had no question that, and it was, and I'll be honest with you, every one of those things have been fairly harsh. Those words from God, and it's been very similar message. And with this, I was sitting there just praying and complaining,
Sure.
And the thought I had that I felt was so strongly from God was, who do you think you are?
The Job question.
Yeah, who do you think you are? And it was as if then my mind went through that process. You can do everything right, and if I choose that for my kingdom, it's time for that child to come to me, then that will happen. But you can do everything wrong. And if I choose, that child can live. And it was a sense of, as usual, when I feel like I'm before God, a very sense of smallness, but a very sense of greatness of God.
Sure.
And so, yes, and I think that's one of the more significant ones. But I think everybody that is in any profession that in particular deals with people, and you have to see hurting people. I know pastors encountered a lot, and that you have this sense of, I can't do this anymore.
It was interesting. It's interesting that you bring that up, because whenever I got into a situation where I had to be so clear in my own mind about what I believed God would and could do in my life, that I had to be just as prepared to know if he didn't do it, that meant he doesn't mean he doesn't love me.
That's right.
And I have faced a lot of folks in 30 plus years of ministry where I've really kind of experienced that dynamic. Now that a lot of people know about my health, a lot of people come to me going, we want the answer. How do we live an abundant life like you have in the midst of such struggle and difficulty? How do we do that? And if the folks who are listening today, I think one of the things maybe that I want us to just hit on as we finish up is, what would you say to those folks, who go, well, you seem to have the answer, and you are, as doctors, y'all are supposed to have all the answers. That's never the impression that I got. You always were very clear that the only one who has the answers is Jesus. But how did you kind of work through that when you knew people were putting their faith in you and not their faith in the one that really knew?
It's one day at a time. I think that one of the real downfalls of some Christians is that they get too far out in the future, the what ifs of God.
Outrun their coverage.
They outrun their coverage. And, God has promised to be with us, but he's promised to be with us today.
Sure.
And that's why he describes himself as the I am. I am today. I am in present. I can take care of your past. There's nothing in your past you can do that I can't take care of if you'll just trust me. And there's nothing I can do that can happen in your future I can't take care of until it comes, except it's got to come.
Sure.
And so I think that the focusing on what's in front of me, whatever you see, do it, whatever you find in your hand, do it with all your might. That focus on that, and then all those doubts and what ifs and even depression and anxiety seem to be manageable. They don't overcome you. Now, they don't go away completely. Was I continually sad for that family and continued to pray for that family that lost that child? Absolutely. Sure. But it didn't cause me not to be able to function at a level that I needed to continue to function.
And I think that's an important point, as you talk about the reason you take it one day at a time is so that you keep things in perspective as to what is and what is not important, what is and what is not the focus of what you're trying to do. I remember, when late in high school, I dealt with eye issues, I dealt with HIV, but the thing that really upset me the most, and you were a part of it, was I had a hip injury that kept me from playing in a series of golf tournaments, and ended up that, it had to be put in traction. It was an incredibly painful situation, but it took me out. And I remember being very frustrated with God. I've been able to deal with this, but really
Come
this?
On.
And I realized what I was doing is I was putting certain things, almost like you would carve an idol. I was putting it out there going, well, I'll just live for this right now.
Right.
And that's not the answer either. The one day at a time is not just the slow down. It's the appreciate part. It's the get your heart up close to his. It's proximity.
It's relationship.
Yes.
It's all about the relationship.
That's where I was trying to go with it. Yeah.
It's all about the relationship. Yeah. And we can make all the other things, and it's not insignificant. Your playing golf was not insignificant. You're being able to function in a way that you considered normal, which, was fairly normal.
Sure.
But all those sorts of things are important. But if you let anything replace your relationships you have in life, first with God, then with those people closest to you, and then your world that you're here for. You're here to bring that kingdom, the kingdom of God, to the world and if we let anything get in the way of that relationship, then I think God has designed it so that we will feel uncomfortable.
Well, next time we're going to talk about why you believe then bad things happen to good people, using a little bit of our story, because the story doesn't stop. We have a whole other season of it. That's a whole other chapter that I think is so very important.
Multiple seasons,
yes. And I look forward to that, Ronnie. Thank you.
It's been great.
Yeah.